So if you are a breastfeeding mother, you might have had the non-pleasure of experiencing a bitten nipple. I first experienced this when my son was about 6 months old and he was falling asleep, and all of a sudden he chomped down on my nipple, and this like ungodly pain ripped through my body. I accidentally bit down on the side of my tongue. I ripped my nipple out of his mouth, which I'm pretty sure further damaged it, and held my breath in pain. And then when I finally looked down, I expected to see a beheaded nipple, but instead I saw a sleeping baby. I soon discovered that my son had developed the habit of chomping down when he would start to fall asleep, and the nipple would start to come out of his mouth, and he would bite it. Needless to say, it was traumatic. I yelled really loud when it happened. That first time it didn't wake him up, but the second time it happened, and I yelled and pretty much had the exact same reaction. Then he started crying, and then I started crying, and it was awful, and nobody felt good about breastfeeding. I have heard a similar tale from many women that I support. Yeah, it's only natural to yell out loud and pull our body away when somebody bites any part of us, but especially the nipple, right? And it's only natural for the baby to have a reaction because, you know, we're their primary caretaker, their nurturer, and we're doing this activity that should be so, you know, calm and enjoyable. And when they bite and we yell, it can be awful for everyone involved. So first and foremost, why do they do it? It is not personal, I can assure you. There are some very normal reasons why this happens. So one of them is that biting is a reflex, you know, just like rooting, sucking, swallowing, gagging. Biting down is just sometimes a reflex that the baby has. If a baby is cutting teeth, and their gums are sore and they just want to bite down on something, that's something that can cause biting. That's exactly, I swear, I think it was the day after my son first bit me, I felt his first tooth coming in. That's something else, is that their brain is just curious about cause and effect. Babies want to learn, if I do this, what happens? And then the last one is they might have a cold, an ear infection. If you notice that they're like pulling on their ear a lot, you definitely want to take them to the pediatrician. But in addition to that, know that one thing you can do is you can kind of get them into a sitting position when they're nursing, and to also use a humidifier in the room as often as possible. And this can help to alleviate any discomfort that they have when they're swallowing, because if they're having that cold or the ear infection and they swallow and it hurts, that sometimes causes them to bite down. So sitting up position for the baby, humidifier can help. And I'm going to get to more suggestions on how to minimize the chance of your baby biting you. Okay, so I just talked a little bit about positioning, but I'll go a little bit deeper into that. So babies are less likely to bite when their head is angled back a little bit, so their chin is facing towards your body and the breast, and their forehead is pointing away from your body. And when their tummy is pressed against your upper abdomen and they have a deep latch. So when they have this deep latch, the nipple is pretty far back in their mouth, their throat actually, and their tongue is covering the teeth. So this makes it a lot harder for them to bite, because if they bit down, they'd be biting on their tongue, and they're not going to do that if they have a really good latch. So again, their chin pointed towards the breast, their forehead away from it, tummy pressed against your abdomen, and really make sure they have that deep latch. You can also learn babies' pre-biting signs. So start paying attention to what they're doing right before they typically bite. And then what you can do is you can make sure to remove your nipple before that happens. So for me, I noticed that Hudson would start to get really drowsy before he would bite down. So when I noticed that was happening, I would take the nipple out before he could bite. Again, we talked about, if your baby is teething and really wanting to chew on a lot of stuff, that could be a sign that they might be more prone to biting. So you really want to make sure they have that good latch so they physically cannot bite down. Okay, another potential sign is if you feel them retract their tongue and they're just like sucking with their lips, but their tongue, the teeth like this, that could be a sign that they're getting ready to bite down. You also want to make sure that they are on a loaded breast. So I talked earlier about how it's pretty much impossible for them to bite you if they are actively swallowing milk. So if they're getting towards the end of the milk in one breast, you want to make sure to switch them over before it's completely empty, because they might continue to just suck for comfort even though they're not getting milk, but because they're not swallowing, then that's when they could bite you. So make sure to switch them to the other breast when one is about to run dry. Okay, so this one's hard, is if they do bite down, unlatch them with your finger instead of pulling away really fast, which of course is our instinct. We just like want to get away from the pain as fast as possible. But the problem is when we just yank our nipple out of their mouth, then sometimes that could damage the nipple further. So what you want to do is you want to like stick your finger in their mouth between their gums, and you'll likely hear like a popping sound, and that means that you've broken the latch, and then you can pull your nipple out. Okay, another strategy is to stop nursing, but not forever. It's important for baby to learn, again, cause and effect. If you bite mommy, we're going to stop nursing for a few minutes. And again, you don't have to stop for days. 15, 20, 30 minutes is enough for them to get the message. When you bite, we stop. And then again, can feed them soon after, but give them a couple minutes so they realize that cause and effect. If you feel like they're teething and using your nipple as a teether, keep teethers near your breastfeeding stations. I did this with my son, and when I noticed that he wasn't really swallowing anymore and he seemed a little bit agitated, I would switch from my nipple to a teether, and then he could like get out that need to bite down on something that was not my body. Okay, so it's really, really natural to have a loud reaction when somebody bites your nipple. And a lot of moms feel really guilty about this because, as in my story, the baby starts to cry when you yell out, and everybody feels awful. So I really encourage you to not beat yourself up if you yell out. It is the most natural human reaction to a bite. So don't feel guilty about that, but you can then apologize. Some people think it sounds silly to apologize to an infant, but apologies are a great way to move past something that you feel guilty about. And while the baby might not understand the words you're saying, they're going to get the energy. They're going to understand that, mommy is sorry for scaring you. I did not mean to, but you hurt mommy. Just talk it through with them. Again, it's going to be very different than a conversation you have with an older child, but it can make you and the baby feel a lot better. This last one kind of touches on something I've already talked about, but I'm going to reiterate it. Really encourage you not to wean because of the biting, unless it was something you're already planning on. If you're already planning on weaning, then fine. You might just do it a couple weeks earlier because of the biting. But, say baby is only 6 months old and you are really wanting to go to a year, I really encourage you to just take some time to work through these strategies to see if baby moves past that phase. For me, my son stopped after about a month, and these strategies help. They didn't completely eliminate them because a lot of his biting was because of teething. So yeah, don't wean. Again, if you didn't already want to, just try to hang in there for a little bit, and hopefully this too shall pass. If you have any questions about this or anything else related to pregnancy, childbirth, or early motherhood, let me know in the comments below.